music so we can dance. Yeah, I like dancing. Yeah, dancing. Oh. Good afternoon, class. And a very happy New Year to everyone. You guys traveled and left me all alone on campus. It's not fair. I told you, college students don't go home. And we would have a class on the 25th of December. And I was here. And all of you traveled, and as if that was not enough, you refused to resume to have your lectures. Today is 16th. It's alright. No problem. I want to think that your holiday was smooth and enjoyable, because I enjoyed mine alone on campus. Yes. We had a class on, was it 20th? You were there? Yeah, just a few persons were here, were there. A few persons on the 20th of December. And school officially permitted on the 21st. Right? Was it 21st? On the 21st. Before 15th, all of you vanished from the campus. And I don't know whether this is how you want to become professional anatomists, nurses, and med lab science. During the Christmas holidays, the hospital was working. So whether you like it or not, if you're in college of medicine, you shouldn't be thinking of traveling for holidays. You shouldn't be thinking of that. Because your training starts from here. People will rush into the hospital on the 25th. And the doctors and other medical officials were there to attend to patients. So that's how it works. Anyways, the next holiday will be Easter. And we'll have a class on Easter Day. So the earlier you prepare your minds, the better. Because I will use this one to catch you. Okay. We have done a lot. We have done a lot in blood physiology. The last class was, I think we did sickle cell anemia, and today we are going to be running on that lecture on sickle cell anemia. And we will have time, we'll go to thalassemia, polycythemia, and then white blood cells and others. Please, this class will last for just 1 hour because I was told that you have a test, right, today? So I'm going to be very quick. You know, in our last lecture, let me just take you back briefly. In our last lecture, we did sickle cell disease. We started by definition of sickle cell disease. And then we look at how babies born with SS genotype come into the world by inheriting abnormal genotypes from both parents. Alright? We did all of that in the last class. And I think I was here synthesizing all of you to go check your genotype, so that will help to totally reduce or eliminate the production of sickle cell babies into the world. And as far as you are in college of medicine, you are going to join us to enlighten and synthesize the public about genotypes and sickle cell disease and their dangers. So, for the benefit of those who are not in that class, by way of summarizing, you will start synthesizing your colleagues who are not a college of medicine. It starts from here. Your friends, your relations, your brothers and sisters, and your village people about sickle cell disease and the dangers that comes with the disease. It starts with you. And I said in the last class that it is a must for you to know your genotype. It's a must. You should have known that from the day you were born. But it will shock you that many of you here do not know your genotype, and it's an error. And I said clearly the last time I was here that if you don't know your genotype and you are already in a relationship, if the person is your classmate or is within this environment, and you know that you don't know your genotype, and you don't even know the genotype of the person you are dating or are about to date, you need to approach the person if it's a guy. You simply walk up to him and say, boo, boo. It's over. And you don't need, look, you don't need to be emotional about this. Walk up to him and say, boo, it is over. If the person is a girl and she's here, please walk up to her Call her on the sweet name you normally call her. Alright? Honey, darling, whatever. And tell her that it is over. It has to be automatic. Because you shouldn't be in a relationship without knowing your genotype. There are other things you need to find out before dating any person. Genotype, blood group, and the rhesus factor are very important things you must know. And you must know these things: the blood group, genotype, and the rhesus factor of your friend. You must. Alright? It is very important. Very, very important. I remember I told you that, look, if after you have gained this exposure and knowledge, and in the end, you produce a sickle cell baby into this world to continue to suffer from crises or things he or she knows nothing about. My dear students, if after this enlightenment and you still produce a sickle cell baby, you will go to hell. There's no two ways about it. You will go to hell. Because ignorance shouldn't be an excuse at this point. God will not forgive you for that. Alright. It's okay to fall in love. It's okay. It's a beautiful thing. It's fine to sneak out from classes into the forest. You can even do it on top of the trees. It's fine. But you must know your genotype. Okay? Alright. Today we want to look at the pathogenesis of sickle cell disease. The pathogenesis, where this is just the molecular aspects of sickle cell anemia. So what really happens? There is a substitution of an amino acid called valine. Valine is an amino acid and this amino acid is being substituted for another amino acid known as glutamic acid. At the cis residual position of the beta globin chain. So when this mutation occurs or substitution, instead of producing hemoglobin A, you produce hemoglobin S. That is the origin of everything. Okay? So look at this area. You would notice that if you count from here downwards, this is 1, this is 2, this is 3, this is 4, this is 5, and this is 6. The 6th residual position of the beta hemoglobin chain. So at this point, at that 6th position, valine is being exchanged or substituted for glutamic acid. So you don't need to begin to crack your brain much. That is just how this whole thing happens in the body. It's a hereditary problem. So you don't blame the child. Because that child inherited 1 hemoglobin S from the father and 1 hemoglobin S from the mother. Okay? I'm not saying we should blame the parents. Those days, there was nothing much known about sickle cell disease or sickle cell anemia. So, our parents of the old are forgiven. But now there are enough enlightenment concerning sickle cell disease and measures to prevent them. Okay? One of the ways to prevent them or to stop producing sicklers is by knowing your genotype. You know the genotype of your boo or your baby before you go into any form of relationship. It's important to do that now. Very important. So another way to eliminate this is the government. Some of you will find yourself in positions, because if I'm in any government position, we will not be talking about sickle cell disease. Because I think there's a need to enact a law in Nigeria. You know, people are AA, some are AS, some are SS. Okay. AA married AA. Can it go? Using AA plus AS, can it work? Yes. Okay. AA plus SS, can they marry? Yes. Good. Supposing a person is AS. AS plus AA, can it work? Yes. AS plus AS, can it work? AS plus AS, can it work? Okay. Alright, calm down. Can we calm down? I don't know, what is the noise for? Some people say it can work, some say no. AS plus AS. Can it work? Okay, if you say no, raise up your hand. If you say no, raise up your hand. AS plus AS. AS plus AS. Okay. If you say yes, raise up your hand. AS plus AS. AS plus AS. Okay. Alright, let me tell you. If a man is AS and a woman is AS, it's a 50-50 chance medically. Alright? Good. Now, there is a 50% chance of the couples to produce children that are AS and they are safe. There's also a 50% chance of the couples to produce children that are SS and they are not safe. But in some cases, the man can be AS, the woman can be AS, and all their children will be SS. In some cases, wife is AS, husband is AS, and all their children are SS. I have seen many couples like that. So the ideal thing to do is to take preventive measures. If you are AS and someone who is AS is coming to wind your hand and is coming to tell you all the sweet things in the world, please, it's a red flag. It's a no-go area. Prevention, but preventive medicine is better than curative medicine. So you have to be careful. Don't tell me Papa will bless you, Papa will do this, Papa will do that. You know, sometimes we get so carried away and deceived by what we see on the screen. There are testimonies in your churches. Where they tell you, okay, Papa, this lady was formerly SS, but during the ministration, they turned AA. And everybody is clapping and jumping without verification. Look, every miracle is followed by scientific verification. If your Papa is against verification to every miracle that is performed in his church, my dear, it is fake. You need to change church. That is the truth. You are just seeing on the screen SS turned to AA, and you are there shouting and clapping and jumping. Have you traced? First of all, you don't even know the person. You don't even know where the person is living. Have you gone to verify? If the person has stopped having sickle cell crisis, you are now AA. Until these verifications are done medically, then it is no miracle. Most of these people you see, they are fraudsters trying to lure people to their church so that they can bring fat tithes and offering. But you are a medical student. So you should be able to verify things. And don't get deceived by what you see on the screen. Because I once had a friend who went for a certain program, certain church, and it's SS. And then because Papa was preaching in the church and praying, and he did like this, and he fell. And then he believed something has happened, that he is now AA. And then he actually went to the lab, did test, and the results came out AA. And I said, this is a big miracle. This is a very big miracle. But, you know, this is a systemic thing. And I've been in this field for a very long time. I told him, continue taking your routine drugs. He refused. He threw them away, believing that he is failing. What lab did you do your test? They called one roadside laboratory. We have MLS students here, and I know that, look, in the future, some of you will go and open laboratories and you will not be doing the right medical findings. This is what we have, just because of money. And that is why there's every need to screen every lab, you see, because some of them, you go there, give them the test results, and they go inside the lab, they won't perform nothing. They will just write results and give to you. And this case was exactly what happened. Nobody performed any test. They just looked at him, this man is looking healthy, can't be SS. But he knows that he was SS right from birth. And you just look at the person, if this man were to be SS, he would have died long ago. But he's over 30, doing well. And they just go and write results, and they gave it to me. And he was, you know, when you think of what happened in church and the lab result, it looks real. So the young man threw away his drugs. And then what happened? He traveled to the village. After 1 month, he had a serious crisis. This one hit him so hard, and his village is not somewhere that is very open where you can access medical treatment easily. And they were calling the pastor. The pastor was praying for him on the phone. They had to get all these, what do they call them now? Auxiliary nurses to be giving him drips and all of that. And okay, they managed to, stabilize it a bit, and they brought him to town. He went to the hospital, and he was receiving treatment. And he kept calling the pastor, and the pastor was still praying. Okay, come to the church. He got better, he went to the church. And pastor says, okay, I think God wants you to serve him. I think God wants you to serve him. So you will go to the headquarters, register in a pastoral school or healing school and all those rubbish. So, you need to be careful. I have said, do not make a mistake about this. If you know you are AS, someone is AS, there's nothing like pastor will bless us. And then we'll turn either AA and start producing normal children. There's nothing like that. So don't get deceived by anyone. AS simply will not work. I know I'm breaking a lot of hearts now. Okay. Well, don't worry. If your current boyfriend or girlfriend is AS and you too are AS, don't commit suicide. Okay? Just end the relationship in peace. Someone else that is compatible with you will come. There is no point being emotional about these things. So it starts with you. Then I was talking about government enacting a law SSAS, of course, cannot go. That is death warrant. And then there are people who are SSSS. Look, you have not seen something. There are people who are SSSS. And they are busy shouting, I love you, Pooh, I love you, baby. SSSS, and they know. So if government would sit up and enact the law, okay, AA, beautiful genotype, right? But they are not superhuman beings. Those with AS and SS are equally humans. The end point is that everybody will die someday. You with your AA genotype, you are priding yourself on and about, telling everyone, I am AA, I am AA, I am AA. You will die before someone with SS genotype. You don't know where and when it will happen. So there's no point. There's no point bragging. So there should be a law where AA genotype should be proscribed, banned from marrying AA. It's a waste of genotype. If I'm a pastor, and I know that there's always routine tests where you go before you come to the church to make sure you are compatible by blood and health-wise. And I find out that man is AA, wife to be is AA. I will not wed them. I will say no. No. If you have a genotype of AA, don't waste it. Look for a very pretty young lady that is AS or SS and marry. If you have an AA genotype and you are a lady, don't waste it. Look for a very handsome, tall, don't look for a short one like me. Those people like tall men so much. Look for a very handsome, tall, broad-chested, AS or SS man and marry. That is how it will work. If we are able to do this, nobody in Nigeria will be talking about SS babies. We would have been able to eliminate all of these things long ago. Alright. So going forward, the mechanism of sickling. Normally, in sicklers, the sickling of the red blood cell occurs when there is lack of oxygen. Alright, when the red blood cells begin to lack oxygen, they turn from normal shaped red blood cell to sickle shaped red blood cell. Alright? Normal to sickle. So, the oxygenation of the red blood cell can cause them to aggregate, alright, resulting in rod-like polymers, which will also aggregate to form long rod-like fibers, alright, and these elongated fibers align and distort the red cell into classic sickle-shaped red blood cell. So the lack of oxygen. Look, you know, the red blood cell transports oxygen. Alright? And it is this hemoglobin that aids the transportation of respiratory gases. So when the red blood cells are, reduced in a person, it simply means that there will be no carriage of oxygen and nutrients to the body cells and tissues. Alright? And it also affects the red blood cell itself. Well, as soon as there is no oxygen supply to a normal red blood cell, it acquires a sickle shape. These sickle-shaped red blood cells, some of them can be reversed. That is, if they receive adequate oxygen supply, oxygenation, some of them can be reversed. Not all. In most cases, if there are enough red blood cells that are sickle-shaped in circulation, most of them will not be able to be reversed. And they are going to block or occlude the arteries, leading to disruption in the free flow of blood. And that is how sicklers begin to have pains. Because if the sickle-shaped red blood cells are occluding the arteries supplying the joints, blood cannot flow to that area. They begin to suffer from joint pains and other bone pain crises. So the ideal thing to do is to give them fluid. You place them on admission in the clinic, give them drips, because this drip will help to flush those sickle-shaped red blood cells. It will also help to boost their blood volume and then boost the red blood cell count, and then they will be fine again. And the drips they receive is quite different. We have dextrose water, we have normal saline. Alright, dextrose water contains glucose. That one is for energy. Okay? But normal saline contains sodium chloride. It helps to boost the ECL volume, red blood cell count, PCB, and so on and so forth. Okay, so that is that. We need to look at the signs and symptoms of sickle cell anemia. The first one is, of course, because they have low red blood cell count or low hemoglobin content or low fat cell volume, they are anemic. Okay? And when you consider the lifespan of the blood, red blood cell in a healthy person and that of a sickler. You know that the difference is significant. Normal lifespan of red blood cell is how many days? 120 days. But I told you in this class that in sicklers, the lifespan of the red blood cell falls to 60 days and below. Okay? And as soon as the lifespan of the cell has reached, it will of course degenerate. It's going to break up. And the breaking of this red blood cell can lead to lack of oxygen, nutrients, and other ingredients that is transported by the blood. So that patient will always fall tired or feel tired all the time. And that is called fatigue. Okay? Fatigue in medicine is tiredness. Alright? Okay. So the next symptom is pain. Pain. Episode of pain. If you observe a sickler properly, you will notice that it's always complaining of joint pain, chest pain, waist pain or back pain, and so on and so forth. So they have episodes of bone pain crisis. Alright? And that is because I mentioned that earlier. It is due to excessive breakdown of red blood cell and sickling of red blood cell, which will occlude the blood vessels, preventing free flow of the blood. Okay? However, some sicklers may have very severe pains that they will need to be hospitalized, because giving them painkillers and other medications, drugs, cannot reduce the pain they feel. So they have to be hospitalized and be given proper medical attention. There are some that have moderate to mild pain. There are some that may not even have pain for a whole year. There are some that keep having this pain for almost every week or interval of 1 month. It's very severe. Alright? So for those ones that have moderate to mild pains, prescribing drugs like normal painkillers, some antibiotics, to kill infections, can return them to normal states. Okay? And then they encourage them to take a lot of food. It helps them a lot. So pain is a common symptom in sicklers. And then there is inflammation and the swelling of the hand and the leg. Okay? The common, of course, pains are even associated with inflammation. It is a common symptom. Frequent infections. Frequent infections. But sometimes infections are the main trigger for sickle cell crisis. Infection can trigger their crisis. If, for example, someone has what is it called, typhoid or malaria, these things are primary triggers for sickle cell disease. So the ability to prevent infections using some antibiotics and the ability to prevent malaria can stabilize them for a long time. Because if you have, even as a normal person, if you have malaria, it will break down your red blood cells. Even the drugs you take, malaria drugs can break down the red blood cells. But when you are fine again, they can return back to normal. But in sickles, malaria, infections will destroy the red blood cells so massively that if they are not careful, they have to be hospitalized. Right? Okay. Stunted growth or delayed growth. In sickles, their growth is usually delayed. Okay? And the reason is because of excessive breakdown of red blood cells, which is supposed to transport adequate nutrients to the body tissues and cells. Okay? In addition to that, we have growth hormone. Don't forget that the blood also transports growth hormone. But when there is low blood volume of cells, the growth hormone will be transported at a very low level, which can also affect their growth. Vision problems or retinopathy. I like to classify this under organ complications because the eye is part of the five sense organs. Okay? But sickle may have visual problem in the course of life that can even lead to blindness. And that is why it is very important for them to receive good medical care to avoid some of all these organ complications. With good medical care, they will not suffer from any of these. How can this happen? Now, the sickles shaped red blood cell, like I told you, occlude the arteries. And if that occlusion occurs in the vessels supplying the eye, you have the retinal artery, the retinal vein, and the optic nerve. The optic nerve is responsible for transmission of vision. The ability to see me is because your optic nerves are still functional. If the optic nerve is damaged, you will go blind. So when these blood cells occlude or damage the optic nerves, it can result into blindness in sickles. Alright, we'll now look at some complications of sickle cell disease. They also suffer from complications ranging from neurological to cardiovascular to renal, in fact, generally organ complications. The first one we have on the slide is stroke. One is stroke. Paralysis, inability to move parts of your body or all of the body parts. Alright? If someone has partial stroke, you may not be able to move one part of your body, maybe the left part of your body or the right part of your body. But if you have a complete stroke, you may not be able to move all the parts of your body. So stroke is one of the neurological complications found in sickle cell disease. And how does this happen? Occlusion of the vessels supplying the brain cells with blood. When these blood vessels are occluded or blocked, a sickler can have stroke. Okay? Acute chest syndrome is another one. And that has to do with the lungs. It is mainly caused by lung infections. Alright? Lung infections. And that is why it's necessary for sicklers to be given antibiotics to reduce infections. Okay? Acute chest syndrome. In acute chest syndrome, such patients may be having pains around the chest region, tightness of the chest, and inability to breathe properly. That is acute chest syndrome. Okay? It can also result from low blood and oxygen supply to the chest. That is what we call angina pectoris. Most sicklers normally have angina pectoris, chest pain, very severe due to low oxygen supply and blood supply. And then we have pulmonary hypertension. Pulmonary hypertension. We have cardiac hypertension, we have pulmonary hypertension. Okay? When the pressure in the pulmonary vessels becomes high, you have pulmonary hypertension. It's a common complication in sicklers, and this can be very, very fatal. Alright? Okay. Organ damage, okay. I've mentioned that before. Organ damage, the kidneys, the liver, the spleen can be damaged, especially when the vessels supplying these organs with blood have been occluded or blocked. So you can have kidney failure and other organ complications. Blindness, okay, I've talked about that. Leg ulcers, alright, is another complication. Sickle cell anemia can cause open sores called leg ulcers. Open sores. Okay, like these things looks like wounds that are rotting. Okay, leg ulcers. Another one is gallstones. Gallstones. Due to the excessive breakdown of red blood cells, bilirubin is released, okay, and it is this accumulation of bilirubin in the gallbladder that can cause gallstones. And if that is not managed properly, the patient can have kidney failure or kidney problems. Right? Because these organs are closely related. And that is why it is important to advise people with these conditions to take a lot of fluids. When you take water regularly, you can reduce gallstones. Very helpful. Alright? Also reduce the intake of snacks. Because all these fatty foods can cause gallstones. Okay. Okay. So that ends the class for sickle cell anemia. The next thing we need to talk about is thalassemia.